Good morning, this is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk with you some this morning about dealing with extra large adenoid tissue. Now you can see this adenoid tissue on your cephalometric x-ray, everything, and you may have large tonsils too that you can see looking down the throat and have the person kind of say oh, and you can see their tonsils pretty good, but showing up on the x-ray the tonsils aren't near as plain as the adenoid tissue. So we send the patient back to the ENT person and say we would like for you to extract the adenoid tissue, and if the tonsil tissue is oversized, we would love for it to be taken out too. This will help you do the case and open the airway for many people who have this overlarge adenoids, and it blocks their airway, and so you take that out and your tonsils are in the way also, so some of them need their tonsils, and the adenoid tissue is not very bad. So anyway, let's take this particular case, has some very large adenoid tissue on it, and I'll have to move it. It's a neat little girl, and she's got a beautiful facial structure. The height of the face is good. As they get older, as they breathe through the mouth more, this will grow down, and you'll increase this lower third of the face, and that kind of messes up the balance in the face. Really messes up the appearance of it if you get way too much this vertical dimension of the face. So let's go ahead and look. We've already started this young lady, and we'll send her to ENT man to do the adenoid tissue actually before we start the orthodontics. So we've taken care of that. Now this case has several other orthodontic problems. These are 6-year molars. Actually the lower 6-year molar should be out somewhere like this here, and need to be bringing this forward about now they would take to bring the upper teeth and the lower teeth in the right position. Need to move the jaw forward to do that. So on the other side, the class 2 situation is about the same. And these teeth down here need to be moved over in this area. So we'll be planning to do that, and we have some crooked teeth up here at the front of the mouth where probably over-retained deciduous tooth may have caused this problem right here. This is the deciduous lateral or permanent lateral over here, and we'll go ahead, and the orthodontic problem here is simple orthodontics. So we've got lots of stuff to show you how to do that. So here we want to take a look at the adenoid tissue, and it's right up in this area of the mouth, right here. And if this grows much, it kind of closes off the airway here and causes the person to breathe through the mouth. If you breathe through the mouth, your tongue has to be in the bottom arch, and so the bottom arch widens out, and you may have caught this problem before this happens here, but then you get into cross bites and all sorts of problems by chronic mouth breathing is one of the main causes for this. So we would recommend sending a self-picture to the guy, and if he thinks the tonsils, which you can't see on the x-ray, or I can't pick them out accurately, but I can look in the mouth and see if there are large tonsils that are just about together and are having a problem. We like to get the adenoids and the tonsils out on somebody like this, and then you can straighten their teeth out pretty good and get them to stay well. So Here we have a problem with an over-retained deciduous tooth running here, and so we get that out of the way. This is lined up pretty good over here, and then this is a shot with the pentarex with a person biting together, and then we'll go ahead and finish out the case. Now here, all we do is get that deciduous tooth out of the way and get this one down in place, and we start opening up the space in the bottom and bringing the lower teeth forward to fill in. Now we're going to have this space from here to here to put these teeth in this area. We'll have to go in there. Now we think of these teeth as more crowded down here, but if you think of it as they're erupting into a larger area, and so they will have some more room when they get further into the mouth. So let's watch this is going through. We took the adenoid tissue out, had it removed, and there'd be a big void in that area, and the airway opens up. So we come in now and just do mostly the plain orthodontics. We're going to intrude the lower anterior teeth, and we'll put an intruding arch on top of that, push it down some, and this is where the young lady had a tongue thrust too. She was pushing forward with the tongue in the wrong way, and so we put these little spikes back here to train the tongue to stay in. Now here we have to band these teeth to solder these on there so that it forces the tongue to stay in the mouth. And that's one of the most efficient ways that I know to deal with a tongue thrust, is put something that really irritates the tongue. And after about 2 times, the tongue will poke down here and hit these, and it irritates it, and the tongue will just stay away from there. It seems to have a mind of its own. Okay, here, now we're holding the upper teeth back at this point, and since we didn't want to open this vertical, we're using an occipital headgear, and you cut the bars off at a certain length in here, where you can pick the maxillary arch up. It's to the front of it. You can raise it all at the front if you make these bars short, or if you go further to the back, you can kind of pick the whole thing up, and you can go back and pick the posterior teeth up and leave these like they are. Most of the time we get in between here, we want to raise the upper anterior teeth to open the bite on the case. And this is an occipital headgear. It is a wonderful tube. A lot of people run around and say, well, we don't ever use a headgear. Well, you're missing out on one of the devices that helps put the teeth in the right position without straining some other section to get them there. Now, if you correct function, sometimes you can get away with it, and that the actual function take care of that. But here this is the inner bowl. It's going back in here like this. In the outer bowl you have a little spike. It gets under the arch wire here somewhere. And then you can pick these teeth up, or you pick them up back here, or you pick up the molar teeth, or you can just pick the whole thing up by this deal that's coming up here. This is an occipital headgear, whatever force. And where you put the bar in here will depend on how you raise it, whether you raise it this way, or just the whole thing come up, or you can pick up the posterior part with the occipital headgear there. So let's go ahead and Now, we take the inner bowl, fits in here, and run it, and you've got a little spike coming off of this, and you put that under your arch wire, so it picks these teeth up as it raises this back there. So you can take the whole maxillary complex and go up by pulling somewhere around in here. You cut these bars and hook up it there. If you go further back in here, you'll pick these teeth up and you'll leave these, or you cut the bar short enough because here you can raise the upper anterior teeth without picking up the posterior teeth. Now that's a lesson in occipital headgear. Now here we've finished this case out. The central here is not in a good position. It needs to come up some and go back in a little bit. I hope that's not where we finished it, but I think we still have some deciduous teeth in there. So this is what we had to get in there early and work on what we had. And so sometimes you have to stay. You can stop and come do the second phase of the orthodontics, or sometimes the two phases just run together, and so you've got a long acting case. It takes longer to do. It looks like everything is pretty well done there. And that's the upper teeth lined up now, but you've still got deciduous teeth in the mouth. And I'm going to quit right there. All this was done in the first phase of the orthodontics. Now we'll hold up here for a lot of times. I'll just make a retainer and hold this like it is. Sorry. And then we'll come back and redo this, or just come back and do the second phase of the orthodontics. Thank you for watching, and I'm going to close out now.